Hi, everyone. I'm here today with Diether Beuermann, who is the Senior Research Economist at the Caribbean Department of the IDB, and Laura Giles, who is the Country Economist for Barbados from the IDB. And we're here to discuss a magnificent survey that the IDB has conducted across the Caribbean to determine how COVID-19 is affecting businesses and also individuals and families across the Caribbean. It's a really, really important piece of work that they've published in their blog. It's titled COVID-19, the Caribbean Crisis, which I encourage everybody to read. But we're here to discuss the reason they did this work and the main findings of this research that they've done in this survey. So without further ado, I'll turn to Diether and ask, Diether, can you tell us what are the most important trends you see emerging from the data, and particularly could we talk about income distribution and how COVID-19 has affected income distribution in the Caribbean?
Sure. Thank you very much for this opportunity of disseminating our work. So all of this information is coming from an online-based survey that we executed between April 16 and April 30. And it asked for several information going before the pandemic and during the basically first 6 weeks of the pandemic. So what we're going to speak about now are the very short-term effects of the pandemic within the first 6 weeks, starting on March 15 until the end of April, right? So the first trend that emerges from this survey were about 12,600 households across our Caribbean Country Department members, and this survey includes our members of Jamaica, Barbados, the Bahamas, Trinidad and Tobago, Guyana, and Suriname. So across these countries, about 12,600 households responded to the online survey. And the first very striking trend that emerges is that if we compare the income distribution that was observed in January, so before this crisis hit, and you compare that income distribution with that was observed in April 2020, within the first 6 weeks of the pandemic, we do see that the share of households who earn below one minimum wage increased sharply, almost double, from 23% in January to 43% in April. So this is first a striking figure, and all this increase in households who are earning below the minimum wage are coming from all the distribution. So basically, all bins of the income distribution of people earning above one minimum wage have experienced a less shift, and therefore everybody now is going. So 20 percentage points of people who in January were earning more than the minimum wage are now earning less than the minimum wage. So that's the first observation. And this is something that is unprecedented and only within the first 6 weeks of the pandemic, as I was mentioning.
Could I just clarify there, and maybe just to reiterate? So we're saying that the percentage of households in January that were receiving minimum wage or less was 23% of households of the 12,600, you said, respondents. And in the first 6 weeks of the pandemic, that almost doubled to 43% of households.
Exactly, yes. And this covers all the
significant increase. Sorry to cut you, but that's a huge increase in 6 weeks. And of course, we would have expected that since then it would have probably increased even further. But yes, sorry, go ahead.
Yeah, what I was mentioned, this is an aggregate number of all Caribbean countries that I have just mentioned. And also the survey has been reweighted with recent household surveys representative for each country so that the numbers, the aggregate numbers match the distribution of the main characteristics of the population to make it representative.
Well done. That's a striking statistic. Thank you for sharing that. So if we move on to the second point, where you're looking at basically the changes in diet of the most vulnerable households. Could you tell us what you found? Well, not just the most vulnerable households, but how has diet been affected by this crisis for the first 6 weeks in the countries and population that you surveyed?
Mm-hmm. So, given this first result of the sharp increase of households earning less than a minimum wage, a natural consequence could be deleterious impacts in the food intake and food security. Therefore, we try to measure this, and also we measure this in a way that we could speak about whether this potential negative impact could be more serious for those that are more vulnerable, who are more vulnerable, right? So the finding, and we inquire for two specific indicators. The first one is whether the household reported going hunger or going experiencing hunger in the week of the interview, right? So this is within April. That's one indicator. And the second one is whether the household reported that they were eating less healthy as compared to a period before the pandemic, right? And basically, what we found is the following. In terms of going hungry in the week of the interview, this is within April, we find that the effects are highly unequal and more serious for those who are more vulnerable. For example, if you see households who earn below one minimum wage, about 37% of these households report going hungry in the week of the interview. However, this is much lower in households that earn, for example, above 4 minimum wages. And the percentage of households reporting hunger among these more advantaged households earning 4 or more minimum wages is only 2.4%. So basically, the impacts on food security are much more serious on those households who, before the pandemic, were earning less than a minimum wage. A similar picture emerges for households who report eating less healthy with respect to the pre-pandemic period. Basically, the percentage of households who report eating less healthy with respect to a pre-pandemic period among those households who used to earn less than a minimum wage is about 50%. And this declines to about 34% for households who are relatively more advantaged, earning 4 minimum wages or above.
And I mean, this chart is a very striking one, outlining that data that you just mentioned. And I find it interesting that even in the high income, or as you classify it here, households earning more than 4 minimum wages, more than a third of those households reported in the first 6 weeks that they're eating less healthy. I find that very interesting because I mean, anecdotally, you would think that if you're on lockdown and you have to prepare meals at home and that kind of thing, for sure you're not going to run to the care. Well, there aren't any fast food outlets available to eat fast food. So I found that quite interesting and striking in the data. But I guess it's an income impact as well as the access to food. If everything is shut down, perhaps you kind of have to make do with what you can get as opposed to being able to have access to the healthy food that you're used to. So it's affecting everybody in terms of the quality of food that we're eating, even not just the most vulnerable, but even those who are not the most vulnerable are being affected. And I found that to be quite striking from the data. So let's shift a little bit and talk about the labor market impacts on the tourism-dependent countries. So your survey looked at Barbados, Bahamas, and Jamaica, but those are the tourism-dependent ones, and then Trinidad, Suriname, and Guyana, which are the more commodity-dependent. So let's talk about the tourism-dependent countries and tell us what your findings were in terms of the labor impact on those countries based on the effects of COVID-19.
Mm-hmm. Very good. Yeah. In terms of labor market, we find very strong negative effects on both type of countries, but the effects are relatively more stronger in the more tourism-dependent countries, right? The Bahamas, Barbados, and Jamaica. In addition, there is also the observation that the negative labor market effects are more pronounced for those who are more vulnerable. In this case, those who used to earn before the pandemic less than one minimum wage. So in tourism-dependent countries, about 77% of people living in households who earned less than a minimum wage before the pandemic report having lost their jobs within these first 6 weeks of the pandemic, right?
Could I just interrupt you 1 second there, please, Diether, because that's a huge statistic, and I just feel we need to emphasize that. So 77% of low-income people in the tourism-dependent economies reported job losses in the first 6 weeks of the pandemic. 77.3%.
Correct. That is the statistic. Among those households. I want to clarify that this classification is not with respect to the current level of income. This is with respect to the level of income that the household had before the pandemic, that is in January 2020, right? So that we can classify with an income level that has not yet been affected by the pandemic, but among these disadvantaged households that now are more, because as we have seen in the first figure, everybody has decreased their income, right? But among these ex-ante already disadvantaged households, 77% report having lost their jobs, right? Yes, and this effect of job losses is less striking among those households who before the pandemic earn more than one minimum wage. So we have a middle income group that we define as households who earned between 1 and 4 minimum wages. And then we have a high income group that we define as households earning more than 4 minimum wages. So for these two groups, the effects are equivalent in terms of job losses, and it's about 36% in Caribbean tourism-dependent countries in the Caribbean, right? So the figure is very striking. So the statistic is 77% among those households who are more disadvantaged, and this goes to about less than half for the more relatively more advantaged households, and goes at 36% more or less. This figure of the most vulnerable households being those that were most affected is also similar in commodity-dependent countries, but the incidence is less serious. For example, in commodity-dependent countries, among these disadvantaged households earning below one minimum wage, the incidence of job losses is about 44%. So 44% in commodity-dependent countries among disadvantaged households, but 70% in tourism-dependent countries, right? So this is more or less the difference. And in commodity-dependent countries, those more advantaged households have observed less serious impacts in job losses. For instance, in commodity-dependent countries, among those households who were classified as high income, that is earning more than 4 minimum wages, the rate of job losses is only 14%. 14%. Yeah.
And what I find striking in this data as well, the distinction between the tourism dependent economies and those who are commodity dependent, is that the job losses were versus business closure. Job losses were more pronounced in the tourism dependent countries, but business closure was more pronounced than job losses in the commodity dependent countries. And that says to me that, you know, the jobs in the commodity dependent countries are probably more secure because the economy is a bit more diversified, but the private sector is probably very dependent, of course, relatively more dependent, I should say, that on commodities than the businesses in the tourism dependent economies. Or maybe I'm drawing conclusions there that I ought not to. But I found that to be quite interesting, that distinction between business closure versus job losses in the two types of economies here.
Yes. Also, what we need to distinguish is that in terms of business closures, still among those disadvantaged households, the percentage of people reporting business closure is still higher for the tourism-dependent countries, right? Where it becomes higher for the commodity-dependent countries is among that middle range households. But then if you go to the high-income households, also in tourism-dependent countries, the business closure is higher than in commodity-dependent countries. If you take the average, you still see that tourism-dependent countries report more business closures than in commodity-dependent countries. And also, I mean, the structure of the economies are different, right? So tourism-dependent countries, all the local businesses are heavily reliant on the tourism, right? On the external sector as well, because most of them are service businesses. In the commodity-dependent country, and we need to take into account that we're measuring these effects within the first 6 weeks, the impact on the commodity-dependent countries will come more from the depression of international prices of the commodity that these countries export, correct? And that could have a longer lag in being observed in the local economy, right? In terms of job losses and business closures. So this data is still very early days, and as this pandemic evolves, this will likely change, right? And could be translated into even more pronounced effects also among the commodity-dependent countries.
Right, and the oil price collapse really lagged the onset of the crisis that would have had a tourism impact very early. So you're right. Perhaps we're going to see a greater impact later on. But just by the way, do you all plan to conduct this survey again?
Yes, actually, we are now, so we're doing different efforts. It's possible that we will conduct another effort online, but currently what we're doing is interviewing directly by phone representative samples that we have interviewed before, so a panel household survey. In the case of Barbados, we are conducting a phone interview on a representative sample that also responded to a survey of living conditions in the recent past. So we are sure that it's a sample scientifically designed to be representative of the Barbados population and that we have already interviewed before.
Right. That'll be good to see and to be able to compare as time elapses, how the data moves. So thanks, Diether. Let me switch to Laura now. And Laura, let's talk a little bit about the social assistance programs. Here in Barbados, most people are very fortunate to be able to access unemployment benefits from the National Insurance Agency. But talk to me about how that's been looking across the region, the kind of coverage that we're seeing in these social programs, and what your data was able to find.
Thank you, Marla. So first, I'd like to highlight the fact that we only survey 6 countries in the region. So IDB does not cover the OECS countries. So with this effort, we were unable to really survey them and tell what's happening. So the countries we did cover were the Bahamas, Barbados, Jamaica, Guyana, Suriname, and Trinidad and Tobago. And there we find that all countries in general are making use of their social service and social assistance programs to support the population. Now, We do very close monitoring of the situation, both in the health sector, economically, and in different sectors. And we find that to date, the main effect of COVID-19 in the region is economic. Countries have been very effective at flattening the curve and reducing contagion, and they reacted fast. However, there's not so much to be done about the economic impacts, particularly on sectors such as tourism or commodities, which is so dependent on other nations. So, and the other thing to highlight is that quite a few countries in the region, such as Barbados or the Bahamas, have general universal access to social protection and social assistance, similar to what we would find in European countries. It's based on the same model, and it's quite different to the model you find in other countries in the Latin American region. So fortunately for the people in the Caribbean, it's channeling social health has been quite fast and quite effective. So we find that for those households in the low income bracket, so those earning below the minimum wage, coverage of social assistance programs increased by 6 percentage points to 30% of the households. Now, you've got to take into account that that includes social assistance programs. People in Barbados will be very well acquainted with, for example, the welfare department programs, the National Assistance Board, but it also covers unemployment benefits, pension benefits, both contributory and non-contributory, which have played a very big role during this time in supporting those that in other circumstances would not have been covered or would not have received benefit because of job losses, even if they were temporary. But something we do highlight as well, and this is an issue that the IDB has been discussing with governments for years now, is that we have a lot of leakage in the social assistance programs. And that leads to inefficiencies in public sector spending, which is something that nobody wants to hear about now. Nobody wants to talk about this in a pandemic when money is needed. But it's a hard discussion to have because at the end of the day, resources are limited. So yes, the social assistance programs in place have been detrimental into ensuring that the hit on households hasn't been worse. But there's also a lot of money going into sectors of the population that should not be targeted by some of these programs. So for example, we find that households in the high income bracket are 4 times and above the amount of the minimum wage. 6 of them would be receiving benefits now, but 24.2% of them would have been receiving benefits before COVID-19. Taking into account, we do also include pensions, unemployment, maternity leave, which is not targeted to poor income households. But there are questions to be raised about how is the targeting being done? Is the money, do we know that the money really is reaching those that really need it, particularly when resources are scarce? And as this pandemic goes on, money finishes. I mean, there's only so many resources you can distribute amongst everybody, irrespective of the amount of loans a country can take or other sources of financing. So that's definitely a discussion that we've been having and kind of raises from this discussion and brings another side to this graph that we present in the blog.
You know, you're so right, Laura, about the targeting, because I know that, for example, in Trinidad and Tobago, the World Bank had been commissioned to do a study on this, and they found, and this was a while ago, and they had found that there was so much mistargeting or leakage, as you say, in the way that these social benefits are allocated. And now when there is so much more urgency, it's harder to imagine how do you go through the process of vetting and verifying. And so there's moral hazard, of course, related to who's going to be applying for these benefits. And you're right. I think it's very sad that in many cases, in many countries, I should say, it doesn't really reach the people that need it the most. And there's some people who are, I guess you could say off the grid and fall through the cracks. And that's a real, really, really sad and challenging and long-standing problem. But hopefully, coming out of this crisis, there will be an effort from these governments to address this problem. And one way I know that we've been trying to address that in some countries is to get the NGOs and the church involved, because they're generally the ones that are much more in contact with people in their community and more aware of who are the most vulnerable in their communities. But I just want to move on to this lovely table that you've done that, of course, is a huge amount of work that went into finding this and compiling it in a table that like you have, and I have to congratulate you on this table. But talk to me about this table that basically outlines what policy measures are being implemented by which countries, and it really nicely summarizes what each country is doing. And it's really interesting to see, for example, like you mentioned earlier, every single country on this table is having a curfew or a lockdown, and every single country has additional funding for the health sector. But when you look further down and you look at the actual policy responses from a fiscal policy standpoint, for example, lower from a monetary policy standpoint, lower policy rates and lower reserve requirements. So in other words, monetary easing. In terms of policy rates, really only Trinidad and Tobago has done that. But then again, who's borrowing? So it's really interesting to see from this table the different ways that the countries are handling this pandemic. So talk to me a little bit about this table.
This table actually comes from the joint effort of all the economics team at IDB. So I really have to thank all the economists and the team for responding so promptly when we put it together. And results from an ongoing monitoring effort since day one that we've been carrying out, really knowing and looking at what is doing, what tools every government's making use of. And it's interesting because if you look into it, doesn't only reply to how the pandemic is hitting different countries, but also what is the institutional framework of all these countries and what are the tools available to policymakers immediately to respond, because it's required such a fast response. Mm-hmm. But basically, we've made an effort to summarize the policies into 6 broad categories, and within them, try and really bring out the main policies, the main programs happening. By no means are these the only ones. We also have to apologize to the audience. We can only capture it at one point in time. As COVID is proving, our situation changes now on a daily basis, so this might be some of these points might be obsolete by now. But essentially, when we put the table together, we see that all 6 countries carried out health and safety measures, and very quickly as well, immediately. The good thing is that most of these are island states, so they were able to close down, stop flights, and prevent the spread much easier than maybe countries in Europe would have done, because it's very difficult to close down borders when there isn't a physical distance. And that has really helped curb the rate of contagion, as we highlighted before. Fiscal measures between all 6 countries, depending on the measure, were carried out. But most countries in the region have carried out a policy response through fiscal policy. And that reflects the fact that quite a few of these countries have fixed exchange rates and have limited response capacity through monetary policy. Most of them have done it through increases in spending, which also shows that 2 of our countries have IMF programs, which Jamaica's just coming out of theirs. But there's been limits as to how much reduction in revenue, on top of the fact that a lot of these countries lost a lot of their revenue, they can really do. So how much tax breaks can be given. And social measures, 5 of the countries increased or introduced additional social protection systems. A note must be said on the Bahamas, they put some money into their social safety nets, additional money, but they didn't make many changes and it hasn't been as prevalent in the press. So it wasn't counted in this case. For example, Barbados introduced 2 whole new programs, and many of the countries have created programs from scratch right in the middle of this pandemic. Financial support for businesses was quite prevalent as well. So between 3 and 5 countries carried out either loan programs or there's employment retention schemes with incentives as well to try and mitigate the impact on the labor market. Particularly because the business community is being very hard hit. And not only the loss in activity in, for example, the tourism or commodity markets. But when you have a lockdown, really you stop demand. So how easy it is for a company to hold on for 6 weeks without working. And it doesn't just affect small and medium enterprises. We're seeing all around the world that huge companies are getting bailed out and are asking. Monetary policy measures, as I mentioned, are much less prevalent. So between two of our countries did it, but that really reflects the fact that many countries that we monitor don't have as much flexibility in monetary policy responses. And finally, reopening strategies. So 4 of the 6 countries are already carrying out reopening strategies. The 2 countries that I've been monitoring closely, which are the Bahamas and Barbados, have done very concerted efforts in communicating the reopening strategies to the population. Very active PR campaigns, communication campaigns, how it's going to work, what people can do, what they can't do, a very phased approach depending on where the pandemic is. And that has generally been the case in the Caribbean. And WHO highlighted Mia Motley's work in facing the pandemic reopening strategy. And I've found, and many of our colleagues have found, the Caribbean has done a particularly good job in coming up with these reopening strategies, doing them in a phased approach, but more than anything, communicating to the population, letting everybody know, different campaigns at different levels for different sectors, just making sure that the word is out there, which seems much harder than you would think. And they are small countries, but it's very difficult to really get your policy decisions out and people understand what you're doing. And with so much information at the same time, it's very difficult to do so. So I think it's something that's worth highlighting for regions and congratulating the authorities to date in the work they have done, and to just encourage them to keep up, essentially.
No, Laura, I agree with you, especially around the communication. I mean, there are some countries that do a COVID-19 press conference every day and invite questions from journalists and so on, and update in terms of how many tests they've done and how many new cases, how many recovered. You're right, they've really done, many countries in this region have really done a good job of communicating and of assessing the problem and responding very quickly. And also in Trinidad and in Barbados, we have basically committees that the government has appointed to look at how do we construct a strategy around economic recovery coming out of this. And so that's also a response that I see that's been strong, and the constitution of these teams look quite strong to me. So yes, there's a lot of good being done, but then again, this is an unprecedented crisis, so we are seeing some unprecedented levels of response coming from the authorities in most countries, which has been quite heartwarming. I just want to end here where you're talking about in the last section of the report that more and better targeted measures will be required from governments. And I couldn't agree more, because that initial knee jerk that we had and that we saw, which like we agreed, there was a really good job being done in protecting people and protecting lives. But this is going to be a long road. Just yesterday, I did a presentation that talked about, some of us were only just recovering from the global financial crisis, or just recovering, or not even yet recovered from hurricanes, Dorian being a perfect example. And now we have this. And so, governments are really going to be required to dig deep and find solutions that they can execute in a short as possible time frame. But it also speaks to the fact that these governments are constantly being challenged one way or another. And of course, I want to say a thank you, especially to the IDB and the other multilateral lending agencies that have come out and supported our countries and our governments in especially in supporting the most vulnerable. The one thing I see missing, I don't know how you feel, is that I feel like we could have had, and we still can, much more of a coordinated effort regionally in addressing some of the longer term problems and even addressing the more immediate problems of opening up and maybe opening up intra-regionally in amongst those islands that have eliminated the virus. But I just feel like perhaps if the one element, if I had to say one element, was probably not missing, but not as strong as I would like to see, is that level of coordination. How do you all see that from an IDB perspective? And this is a question I'm throwing to both of you, either one of you who wants to respond to that.
So I can go ahead, Diether.
Oh, please, ladies first.
So, all right. It's been a very challenging time, and it's not come in a vacuum. So COVID came in the midst of escalating tensions, more nationalistic movements happening, not so much in the Caribbean region, but in the wider Latin America, Caribbean, and Western Hemisphere, it was a very prevalent issue. So what I've personally experienced is that everybody sort of stopped for a few weeks. And I did see a lot of cooperation and a lot of discussion at, for example, the ID level between countries, lessons learning, sharing experience. We've had testing kits come in from all over the world. We've had support to the health workers as well from different nations. So it's been quite heartwarming and encouraging in a way. But regional integration is an issue in the Caribbean, and I do agree that they're really not making the most of what a coordinated approach would bring. I again commemorate these efforts in bringing together the region. The region is one voice, so she has been a very advocate in institutions in Washington, D.C. to bring together the issues of CARICOM and the Caribbean as one, everybody's issue, one issue. But I agree, more needs to be done and more actions. There's a lot of discussions, there's a lot of seminars, there's a lot of meetings in the region, a lot of promises of what everybody would love to do. But the institute, CARICOM, is not, the CSME is not new. And CARFA, for example, has proven to be so effective and so helpful. And what an investment that has been. So this, I think, comes to show and brings out the importance of regional.
I agree. CARFA really has demonstrated some strength. Diether, you wanted to add?
Yeah, I mean, in light of the current situation, the issue of coordination, I think, is not only a challenge of the Caribbean, but it is, I think, a general challenge. I mean, we see that basically coordination in actions on where to go is basically null everywhere, right? Either if you see Latin America or Europe or North America. So I think it's a situation that nobody was really prepared for, and therefore it even complicates more a coordinated action because there is no consensus also on the most appropriate responses, right? And so the uncertainty is high, right? And I think we need to go day by day.
Indeed, one day at a time. But I think it's an opportunity. This crisis has really showed us, I think, the need for more regional cooperation, and I hope we look at that. Again, I just want to thank you, Diether and Laura, for this work that the IDB has done, and your colleagues as well, in doing this fantastic survey. This data is really valuable. I congratulate you on doing it, and I hope that the sample that you're doing to update will also be published, so we can see how things have progressed as time has passed under COVID-19. And I look forward to further discussions on this, especially an update on that table, Laura, so that we can keep track of what everybody is doing in one nice, neat place. So again, thank you for that work. I really appreciate the work that you've done, and I look forward to chatting more on your survey and this particular work as time progresses and we get more data. Thank you so much.